That pulls down too, not quite as strong. We don't really want to hit that because that makes our smile really uneven. But then the chin, you know, as soon as you start to see that like kind of frown over the mentalis, you want to put some support there, because as the bone starts to go down, the chin starts to come up. And then, you know, I think of all the platysmal bands. Can you go like E really hard? Yeah. So you can see where she's getting that pull from down here, right? Now, I don't go overboard with platysmal bands because, you know, when she's relaxed, you can't really see them. But if she's saying anything about not liking her lower face, even just putting, you know, 2 units here, you know, pout out your lower lip for me. You can see right where she's constricting right there. You can see right where the pull is right there, right? Even just doing 8, 2, 4, 6, 8, just that. Now, if you extend it and put a little bit right where she's getting that jowling, again, you'll get, the lifting muscles will just get a little bit stronger because they don't have the resistance. It's no different than the forehead. If you weaken the glabellar complex here, then her frontalis muscles are stronger. Smile for me as big as you can. So, I mean, maybe a little bit back, and this is where you can really start just using a half and a half. Just, we're in big time maintenance zone, right? We're just maintaining. That's it, super easy. You're gonna go to bone, you're gonna put a few pops in there. It's gonna be perfect for another year, like great. When we go down, probably feeling a little bit the same as the other model did, where again, pretty impressive jawline, honestly. Nothing's hanging below the bone. You can still see that she's got, you know, she's got some nice bone structure there. Would it hurt her to have a little bit more because she's probably starting to feel some of that laxity? No, I mean, you could put a little dollop, and that's no different than the cheeks. You just pull that skin back, find the bone, use the bone. Inject a little dollop on the bone.
Okay.
Yeah, and we can show you how to do that too. Imagine you've got her mentalis muscle. You're not going to inject the mentalis muscle, right? Unless we're doing chin. You're not going to inject the jowls. This little padding right here, nasolabial fat pad. Everybody has them. Look at little babies. You will see they've got puffiness here and they've got puffiness here. They kind of go away in our kind of young, you know, I would say 20s and 30s, then 40s and 50s, and where you really see it is 60s and 70s, where they kind of lose their lip and it just becomes, this padding just gets really soft through here, and it's almost like an extension of the lip. I'm not sure if you can kind of picture that.
Yeah.
So we don't want to add that, right? We don't want to add fat to a fat that they don't like. So where does that leave us to inject? And that's it.
There.
I mean, we literally only have this little area, right? Because I'm not taking away this skin. Now I can release that pull down by doing talks there and maybe like a little bit above, but I don't want to inject this area, right? So
you just do like a couple like boluses
literally,
on the bone maybe, and then fan.
Literally,
Okay.
it's literally that easy. Now, the one thing you have to be careful about is that mental artery.
Yes.
Because that mental artery, where's Linda? It is right where we want to go. So we're basically saying that we want to go kind of right through here, right? And we want to lay some product on the bone. So that would be a real bummer if you put that right in that mental artery, right? You know, if you're feeling uncomfortable with that, you can come in and just lay the line like we did. Or you could, you know, just really feel that bone and make sure you're just right at the bottom and put like a little dollop there. But this is the only area that we have, but it makes a dramatic difference. And there's a lot of injectors who don't do it because they work for a corporation or they work for a medical director. It's off-label. I mean, where do you find in an injection book this space? It's kind of like you can make up a name for it, right? It really makes a dramatic difference for people where, again, it just kind of, just like making the line right here will hide the jowling, putting some up here. Now again, you don't want to go up there. And even as people get older with their smile lines, I won't even go below about right here. I just do this triangle because otherwise I'm going to draw fluid into their nasolabial fat pad. And they're not going to be happy with that. And then, you know, let's say they don't like it, you see them back and you're like, oh, that doesn't really look that good. Or they're noticing that it's a little bit squishier, they can't quite put their finger on it, but they don't like it. Well, how do you hyaluronic that? Because it's literally, you could have just like a few scattered hyaluronic acid molecules, it's mostly lymph fluid. So without like really fully dissolving the whole area to get rid of like any kind of HA molecules so that that lymph fluid will go away, and then lymphatic drainage, they could be just kind of stuck with a fat pad that's a bigger fat pad. I think as injectors, I think we do it all the time, because I know for me, the first few years of injecting, that's what the book says. You put one syringe on each side. That's what you do. And they don't even talk. I mean, it took me until maybe 2 years ago when I was trying to figure out what was going on of the nasolabial fat pad. They don't really talk about that.
No.
Yeah, anywhere. No. But no one wants those to be bigger.
Yeah.
And yet, when we're laying down just a syringe of filler on both sides, we're literally telling all the lymph fluid, come on, lymph fluid, and then fat collects fluid. So you're bringing in the fluid, and then it's getting stuck in fat, just like it'll get stuck in the hyaluronic acid. So I'm gonna show you how to do like little tiny small injections. And it's a little pinchy. Okay, so this is gonna pinch a little bit, the Septicane. So 3, 2, 1, deep breath in. And I like to do just like a little touch right there, and then like a little touch right there. Sorry, just a little drop, because that will make it, when I kind of go in, just like, and this is a great thing, I want to show you a little more superficial, so that when you separate all your filler for lips, and then you're like, oh, their lips really look good, they don't need any more. Take that last 0.3 and just, you know, you don't have to pre-numb them, but like you could even just use an ice stick and then just give them a little support. Okay. If you did that every time you did someone's lips over, oh my gosh, it would be such a like freebie gift that you could give them, where that lower face would look so good. Because you can see, do you see that line right there? Like that's bone loss. And so it's like, if you think of bone as the framework of your skin, as that framework starts to break down, we're not growing extra skin. You know, it just doesn't have that frame underneath it pushing it out. So a little bit of filler there won't widen, but it will provide some nice support. I would say if you want to use those lines, then what I would do is then also come straight down from here.
Okay. Straight
down. Because now, if you watch it when she smiles, now you're still kind of separating this space out here. This line, I would say, is right where her transverse artery is, so that might be a nice little thing to be like, okay, this is the transverse artery. Okay, this is like, but I don't know. Most important is separating lateral from medial, because like, for example, she does not need medial. If anything, you can see right where that malar fat pad is. If anything, you know, putting a little support there, but really, I mean, she's got great volume. Just a little bit back here, we'll just pop her out a little bit and just kind of keep that collagen production going. And once I have the bone, then I'll kind of like fade around. Just kind of, if anything, I'm going to separate this, and then I'm going to come back. If you want to separate into 4s, you can do this, right? Because now you have this area, and you have this area, right? This is going to be her gonial angle back here. But that would be the most I would do, is just to keep you from meandering over into this zone, right?
Right. That's what I'm feeling it.
Yeah.
All right.
And then what's nice too is you'll grow your confidence in your assessment.
All right, poke.
Perfect. And this will take some time for you to get comfortable with, but like, don't be afraid. This filler it's good for the skin. It's good for the tissue. It's not like, it'd be different if this was like a drug that was like burning bad old tissue, and you had to be super careful to only keep it like right where it needed to go. But it's not. This is going to make every area that, it's like you planted flowers and you're like, oh, I see an area of grass that's kind of dry. Let me just spray a little fertilizer. If you've got some extra, by all means, you know, spray a little fertilizer over there. It's just going to make it more beautiful. You're not going to hurt her with a needle. Even if she has a bruise, that's nothing to what they do when they're in surgery. Literally nothing. A needle's not going to hurt anyone. A little bruising is not going to hurt anyone. It's all going to heal perfectly. There is literally nothing that I can do. The worst bruise I've given someone is nothing compared to what they do in surgery. So now what I'm going to do, and it shouldn't hurt her too bad, because you can see those little drops of lidocaine. But I'm going to go in, And now, it's like you're not aspirating with this. You're literally just going in kind of that superficial to deeper fat pad, and you're just kind of doing these just like strings of support. So we're going to come in and just kind of just give her little supports throughout here. Some of these might be a little bitey. The downside is like, she has 2 drops of lidocaine, but you're going to kind of go all over, right?
I don't feel it at all.
Oh, good. Okay. And then again, I don't want to inject this, right? And I don't really want to get too much in here, but what I can do is just really, this is kind of a little bit more to that ferning technique. I don't know if you've there's some people who do everything in the face with just little drops of support everywhere.
Wow.
And so when they have that line all the way across, it's time just to, even if you just open up the conversation, like, hey, just want to point something out that I'm noticing. This is something, and I try to make it like no pressure, like at some point. At some point in the next couple of years, let's address that, because, and if they've been noticing it, they'll be like, oh my gosh, yes, that's what I've been, and they'll be so thankful that you point out, because again, this is like a no-name injection. It's just finding some areas of laxity and putting some support in, but like what a major difference from one side to the other. And this would be something probably once a year, because we're not building out a ton of bulk. We're just kind of giving a little bit of support in the tissues. I'm just going to go over just a little bit. And you can use this method a little bit too in the nasolabials. Again, she's got great support. I'd never add anything, but if you're like, oh, I've got a little bit left, let me do a little bit here, a little bit there, just use a little bit of pressure and find where is she, because look I'm using the same pressure here and there's really not anything. But then I come up here and I'm like, oh, yep, that's where I've got some laxity, right?